All right, it is time for Ask the Derm. Board-certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer your skin questions. Let's go ahead and get to our first question. I traveled to Mexico about 8 years ago to get some cosmetic work done, and I've had my lips filled. I've got these large bumps on my upper right lip ever since. Please help me. This is Sally. Sally wants to know what's the deal with this. Oh, it's on the inside, huh?
Yeah, you can see on the picture on the left, it's actually see the bumps there.
Yeah.
So this is a really interesting case, and it just kind of highlights the importance of really thinking about whether you should travel to Mexico for cosmetic work or any medical work, because in this instance, she had this done about 8 years ago, and she has these horrible lumps actually. And we were going to show a video. I brought her into the office, and I just kind of took a scalpel blade and I poked each bump and I pressed, and all this white material started coming out.
Ooh.
So it's clearly a product that we would never use in the United States because it's not safe and you have problems like this.
Yeah.
But if you want to see the video, you can actually go to our website, or I think our YouTube channel has it. It's pretty neat.
I don't know if I want to see it. It sounds disgusting. Bless her heart, but you were able to fix it.
Yeah, so she looks great now. I just did this about 2 weeks ago.
Wow,
so,
interesting.
Yeah.
All right, now next question. I feel embarrassed to wear tank tops or raise my arms because it looks like I have a dark shadow in my underarms and it seems to be getting worse. What is causing this? Heather wants to know. This is actually in her armpit?
Yeah.
Okay.
Now you see this more commonly in patients with darker skin types. Like someone like me or you have very fair skin, it's less likely to occur. But what's happening is, with years of repetitive shaving, you have this inflammatory reaction. You know, with the blade going across the skin, it causes a mild degree of inflammation. And what that does is it causes your skin to release pigment, hence the darker color.
Okay.
So what do you think the best way to treat that might be?
Inject it with Botox. I have no idea.
Darn, no.
What?
No, what we can do, the best way is to actually do laser hair removal, because if you get rid of the hair, you don't have to shave and that problem will go away.
Okay.
So that's probably the best treatment.
And just one time, or you have to continue to do
With
it?
laser hair removal, it's usually a series of, I'd say, 5 to 6 treatments,
Okay.
spaced about a month apart each.
And then that takes the hair away completely?
Yeah, about 90% probably.
Very good.
Yeah.
Okay, I recently got Botox in my forehead. Now my eyebrows look like Spock from Star Trek. Can you please help me and fix this? Thank you so much. This is Jacob who wants to know. Oh, Jacob, you look just like him.
Yeah, wow, they're like twins. No, if you look at the lateral or the brow off to the edge of the face there, see how high it goes? I mean, I think we've all seen this. I see it almost, I mean, a few times a week. I'll have patients come in who've had Botox injected wherever, and they have this weird, strange, we call it a Spock look or a quizzical look. So the important thing to know is it's very easy to fix. It just takes a little drop of Botox here and there, and that brings the brow back down.
You just pointed to it, like right here?
Yeah, you put it right about here.
Yeah.
And here, because patients will walk around for months like that, not knowing there's an easy fix
for it.
Yeah.
Okay.
So,
and then you put, what did you say you put there?
just a little drop of Botox there, which will bring that brow back down, on both sides.
So
right
it's,
there.
I guess, somebody who didn't really know kind of what they were doing?
Yeah, probably.
Yeah, amateurs. They weren't like you.
Yeah, I don't know.
All right, last one. I just turned 50 and my upper eyelids are getting heavy and creepy. I don't want to get eyelid surgery. Are there other options? Alma wants to know. All
So
right.
if you look at Alma's eyes, you can see what happens with age. Once you get into 40s, 50s, certainly 60s, is those upper lids get heavy and they start to fall down and sit on the lashes.
Right.
And of course, there's some wrinkling under the eyes as well. So what I did with this patient is I did laser resurfacing. You can see, look at the amount of tightening she got on those upper lids. So it's non-surgical. There's no cutting, there's no stitches.
Oh, that's good.
I mean, there is some downtime because you have to heal from the laser, but it works really well. You can see how nice and smooth and tight those lids are afterwards. So.
Huge difference.
Yeah.
Dr. Groff, thank you as always.
Yeah,
To
you're
get in
welcome.
touch with a good doctor, go to our website, fox5sandiego.com. We put all the information up on how you can contact him. All right, let's